Hello, my name is Peyton Thomas, and this is a presentation on Medicare and kind of what it is, who it covers, what it covers, and stuff like that. So basically, uh, what Medicare is it's a type of insurance program that covers a certain group of people and allows them to have access to medical assistance without having to pay high costs. The people who take advantage of Medicare will still have to pay some costs, but they won't be nearly as high as they would be if they did not have Medicare to back them up. So a brief history of Medicare is that in 1965, more than half of the population that was 65 years or older in the United States lacked health insurance in any form. So Medicare was created in 1965 and put into action in 1966. And it was intended to provide health insurance to seniors and certain other individuals. And today it covers more than 55 million people who live in the United States. Medicare is administered by the Centers for Medicare and Medicaid Services, formerly the Healthcare Financing Administration, or HCFA, which is a federal agency within the U.S. Department of Health and Human Services. Medicare is a government subsidized program, also known as an entitlement program. And in 2016, Medicare accounted for about 15% of the nation's federal budget, or about $675 billion. And so now I'm going to talk about who Medicare covers. And it mostly covers people who are 65 years old or older, but it also covers young people with certain disabilities, as well as people with severe renal disease or failure. And there are four different parts of Medicare: Part A, Part B, Part C, and Part D. And what each of these parts, they each kind of cover a different part of uh, kind of the whole healthcare system. So Part A covers hospital stays or stays in skilled nursing facilities and sometimes hospice. Part B covers the services of doctors as well as any medical supplies used in treating the patient. Part C is also known as a Medicare Advantage plan, and it is contracted through private insurance companies who work with Medicare to provide health insurance. And then Part D covers prescription drug costs. So a patient with Medicare coverage is issued a card just like the one pictured in this slide. They're issued it after they have signed up for and have chosen their coverage and what parts they want. And then once they've chosen all that, they can use this card to access their health care plan. So there have been some changes proposed towards Medicare, and it is in order to cut costs. They propose that they would gradually raise the age eligibility for Medicare from age 65 to age 67. Raising this age would likely save little money and could impose cost burdens on vulnerable seniors. And the future of Medicare is Republicans in Congress have said they want to follow up the 2017 tax bill success with reforming entitlement programs such as Medicare to make them look more market-like. And after doing all this research and kind of learning, I came to the conclusion that Medicare is important because it provides essential health insurance coverage to one of the largest and most vulnerable segments of the U.S. population, which is mostly senior citizens. And uh, with age, the health of the body starts to deteriorate much more rapidly than in a younger and more healthy person. which means that senior citizens will require uh, more medical care and health care, which can be a problem because most of them are retired and they don't have a steady income to fall back on. So Medicare kind of helps to help them save money when it comes to their medical care, because not the whole price isn't put just on them. It is also put onto Medicare. And so thank you for listening to my presentation. Um, these are the references I use to uh, get all this information. And yeah, thanks again.